Now, doctors at Gaza hospitals struggling to care for patients, including newborn and premature babies. With no power, they rely on generators, but fuel shortages have reached critical levels. Doctors are forced to cram multiple newborns into a single incubator, leading to the spread of illness and, in their own words, the inability to deal with the problems. According to the UN, only half of Gaza's 36 hospitals are functioning, and only partially. For more, let's bring in Dr. Margaret Harris, who joins us from Geneva. She's a former spokesperson for the World Health Organization. Dr. Harris, the situation at this one hospital, we just showed our viewers a video of these tiny newborns, these preemies, crammed into one incubator because these hospitals don't have power. They rely on generators. Now they're running out of fuel. Do these newborns and infants even have a chance of survival in these conditions?
Good evening, Asieh. No, they don't. The only reason premature babies survive is because we have the technology to keep them going while they're growing up, to get to the level of development where they can live outside, live normally. But without power, you can't keep the incubators going, you can't keep the monitors going, you can't keep the drips going, all the things you need to support these tiny babies while they're growing up, doing their best to grow up to be able to survive as a normal newborn. So no, they will not survive if that fuel is not provided. And I know that my former colleagues in the WHO, but in the other UN agencies, have put out a statement begging to be allowed for the fuel to be let in to power these hospitals.
Talk about what 20 months of war in Gaza and relentless Israeli attacks have done to the entire healthcare system.
They've destroyed it. Now, the only reason we're seeing anything functioning at all is down to the healthcare workers and the international healthcare workers who've come in to do what they can to help as well. The healthcare in Gaza is not anything like what you or I would understand to be adequate. Many of the hospitals are really working as first aid stations only. And the fact that they still continue to help people survive the awful injuries is down to extraordinary commitment by the healthcare workers. But remember, they are exhausted and they're terrified and they're losing colleagues every day.
Yeah, UNRWA's Philip Lazzarini, on a social media post, Dr. Harris, and I believe this is on Friday, he wrote, "Under our watch, Gaza has become the graveyard of children and starving people." He goes on to say, no way out. Their choice is between two deaths, starvation or being shot at. And from what we understand, the majority of those victims who've been killed since this conflict started are in fact women and children.
This is exactly what I'm hearing as well. In fact, my colleagues say, can it really be getting worse? And yet it is every day. And it's as if the world has become numb, that things have been so bad day after day that they seem to be turning away from the terrible loss of life of innocent children who've been sent out to just get water for their families.
Yeah, and of course that was overnight. Children who went to get water, at least 6 of them were killed after Israeli strikes. And with no sign of a ceasefire, Dr. Harris, what does the future look like for the Palestinians in Gaza?
It is a death sentence, and everyone in the world should be standing up and demanding a ceasefire. It should have happened, as we've spoken, you and I, Asieh, many, many times. It should have happened years ago. This situation should not be tolerated by the rest of the world. By standing by and allowing it to happen, we are simply sentencing the Palestinians of Gaza to death. And
finally, Dr. Harris, what is going on at these aid distribution sites? run by the Gaza Humanitarian Foundation. According to the UN, some 800 people have been killed. They've been either shot at or there have been some kind of strike. What is happening there, and why is it turning so deadly for people just to get aid?
So I can't speak for what's happening there because, I've not been involved, nor has anybody else from the United Nations been involved. But when this plan was mooted and there were discussions with all the UN agencies, they said, don't do it, because that's exactly what we feared would happen. Now, honestly, it's our worst fears. We all hope that any kind of aid that could provide any kind of food to Palestinians under this terrible blockade of all kinds of humanitarian aid of any kind would at least bring food in. But we warned of the dangers of forcing people to come to just a couple of points and to go through battle lines, front battle lines, and to be there at terrible risk. Frankly, I didn't believe it would be as bad as this, that people waiting in line would actually be shot at.
All right, a very difficult but important conversation. Dr. Margaret Harris, thank you.